Ladies and gentlemen, welcome at the think tank area at the premises of CERGE-EI. My name is Daniel Milik. I'm not the important person here today. I'm here just to introduce our guest speaker here. But let me note a few things at the beginning. I'm happy you are here, and also I welcome those who are online. This is a special event, not only because it's a joint event with Občan Association, but it's also important because it mixes several, not only topics, but fields together. Big data is a big topic for some years, right? But big data is not enough. It's not nothing if you do not combine it with good analysis, for instance, econometrics. And if you do not combine it with knowledge, detailed knowledge of the topic covered by the data. It's the common problem that IT people can manage big data, but don't know how to find the wisdom in the data, if I say it this way. So this is a great pleasure. We have here Roland Sturm from US or Rent.
California.
California, who will talk about those three areas of research. Let me introduce him briefly. He is professor of policy and
Policy analysis.
Policy analysis. So each keyword is there at Roland School of Public Policies. And he spent several decades working on big data. So big data are not so new as I mentioned at the beginning. And he focused on very different things like insurance claims, which happen to be in the big data, or credit card purchases, or supermarket
Scanner data.
scan data, and many other things. And interestingly, he started working on health topic, which is going to be the topic of today's presentation. So I think it's enough for now. The presentation will be about 45 minutes. Very important questions can be asked during, but we expect that there will be a time window, sufficient time window to ask questions at the end, and there will be refreshment at the end.
Thanks for coming here in person, and thanks for taking the effort of logging in. The big data and microsimulation, two completely different topics that I want to bring together. Look, big data. I always claim I've been doing big data since before the term was capitalized. By then, of course, big data was much smaller than it is now. But fundamentally, there's tremendous of data that are being generated, and they're proprietary and confidential. No, it's not on the internet. Forget about your web scraping and all this. You have to dig into the people who control the data, but there's a lot there. And we want this big data because large data are estimated to estimate small effects at the individual level. Well, some of you might be in the medical field, but for economists, look, economics, policy, they have small effect on individuals. That's not like cutting somebody's belly open, right? So we need big data, large data to detect the small effects. It's not that they're unimportant, because small effects on lots of people still adds up to completely different mindsets into medical field. Major effects on few people. All right. And the second part is, I want to combine two pieces that really don't seem to which is the microsimulation. Microsimulation is kind of a natural fit with microeconomic models. Different approach to macro models. We made a lot of progress because of computing resources. The idea is not new. The ability to do that is much newer here. And it's hard to get coherent modeling parameters. I'll tell you later here. I like to be able to estimate my input for the simulation models in a coherent way. So let me step back. Microsimulation, if that's not obvious to them. How do we model and predict systems? Well, the task for economists, right? How do we predict things? Systems are made of smaller units. If you do cars, traffic, well, there's cars and roads that create the traffic networks. Molecules, if you're a chemist. And for social scientists, well, it's people's, household, business, and economists. macro level changes result from actions of those micro units. Right? So it's the companies, it's people that determine later on what GDP is. How do we model this? Traditional, of course, the macro outcomes were estimated using macro models, macro simulation. GDP, unemployment rate, these are abstract concepts. Have you ever walked the street and run into a GDP? Not really, right? So these are these aggregate parts. And traditional macroeconomics was all about the relationship between the macro variables, Keynesian models. There were no individuals. This GDP talks to interest rates, talks to LM and what other curves there are. That leads to the time series Keynesian models. These large macro models, they really fell out of favor in the 1970s. But that's what econometrics used to be in 1940s, 50s, 60s. You can also model macro outcomes with differential equations. And now we're in the field of engineering, right, and physical science. Scientific computing, you wanted to get a degree in scientific computing? Really, that means numerically solving differential equations. Even as economists, we've seen the predator-prey and the infectious disease models, right? This is all differential equation models. So there is a micro connection here. There is, if you have infinitely many micro units and they also have identical properties, well, then the differential equation approach is a great approach to go about. That, however, is not really how we think about social sciences. We do not think about identical people being all located in perfectly mixed at the same spot, which brings us to the microsimulation of macro systems. So we're still interested, remember policy, we're still interested in macro level changes, but we model them from the actions of micro units. And we simulate the micro level behaviors and aggregate. Often the micro behavior is better understood than macro behavior, and it really helps us with understanding distributional effects of policies or effects of policy heterogeneity. There's no best approach, period. No best approach, right? And so if somebody tells you this is the thing to do, no, it's not, right? It always depends on the application and the data availability. Sometimes it's really best to start building a macro model, take your aggregate data, relate those relationships, time series. Fine, this is a good start. Later develop a micro model as your questions become more refined and as you actually learn something about your topic more, then start building models. In many areas there are really parallel models. So the beginning of micro simulation, it's not new. No ideas are new, right? They develop over time. So 57, Guy Orcutt, I would consider him to be the founder of micro simulation. And this would be the article, the seminal article. His argument was macro models do not model distributional effects. In order to make a coherent model, like if you have a coherent micro model, how to aggregate it to a model, you have to make ridiculous assumptions about the individual levels in order to logically aggregate it. So you can have stable relationships at the micro level and they still can have completely unstable relationships at the macro level. And over time, Lucas critiqued all of this. This is why macroeconomics kind of fell out of favor in the following 20 years.
So, sorry,
yeah.
Maybe I just missed something. What was the reason why they fell out of favor?
For basically this argument here, the Lucas critique. Okay. Right? He got a Nobel Prize eventually for it. His argument was, well, you know, the micro levels, they don't really aggregate. People are rational. And so the relationship between macro units is unstable inherently. So let me give you the terminology. There are two pieces floating around. The microsimulation or agent-based model, and they can mean the same thing or can mean completely different pieces depending on which sub-area you are. So both deal with micro units and agents that are aggregated to a macro behavior. And the way I distinguish them and the way sort of the International Microsimulation Association would distinguish them would be agent-based models. They're kind of theoretical, they're abstract, they have little empirical content. surprising dynamics, but they're qualitative models. I wouldn't call them toy models, but they're not empirically useful. They cannot really do much about policy information. Microsimulation is applied in empirical. There are more limited dynamics and interactions for it. As I told you, it's a common distinction, but not universal. So talk to your audience. Sometimes they do things. So I'll give you my definition, how I distinguish micro and macro. So, well, I told you, this guy Orchid, he was at the Urban Institute, really. This did not start at university, started at think tanks. Guy Orchid was at the Urban Institute. We're talking agent-based modeling. This is Tom Schelling. This was a Rand paper. And arguably, I would say this is one of the main pieces why Tom Schelling eventually got a Nobel Prize in economics. His models of generation. Now, I would love to show you how this works. Maybe I can click the link. So his dynamic model of segregation is still probably the best known agent-based model, published in the Journal of Mathematical Sociology. And I still like his point. It goes back to the distinction I gave you between microsimulation and agent-based model. So he is an agent-based model, and he said, these models are so abstract that nothing will make them look like a reality. Their comparative advantage is in the direction of simplicity than detail, so they're not for policy information, they are academic conceptual models. I'd love to show you that slide. I hope we can open it. I have no idea if this works well.
Maybe if you keep control. No.
Okay, so for those of you who teach this, I recommend, I mean, students love that stuff. They eat that up. Giving them some conceptual models. NetLogo is a nice thing quickly to teach, show conceptual, they can play around, they can develop their own model. So this is a software package called NetLogo. This is an implementation of Tom Schelling's model in NetLogo. So, if you've never heard about the segregation model, Tom Schelling's idea was, we see segregation in the US, residential segregation. There are black neighborhoods, Hispanic neighborhoods. So are people racists? Well, that's has been the story about it, right? That segregation is a reflection of racism in the society. So he built a model where people are not racist. In fact, people love living in mixed parts. They just don't want to be the only person of their characteristic in the neighborhood. But they're fine if 70% of the population is different from them. They just don't want to be the only one. So this is what I call the percentage similar wanted, 30%. You're happy if you're in a mixed neighborhood with 30% of your people like you, 70% different. And then here after density, I'm going to create a city where 95% of the buildings are occupied. Off. And here just two people, right? White is nobody lives there. So the people who are not in a total minority, have at least 30% similar people, they're happy, they want to stay there. The ones that really are isolated and feel like they don't really fit in here, they want to move. So what happens is only the people that are unhappy move. Here they move, and they move, and they move, and segregation appears. Not a thing of racism. Let's do that again. Let's start with a new population. Do it. So you can click through it. So if you do it with students, so they can see the dynamics, how dynamics evolve over time. Right? You get desegregated neighborhoods, and you can do that many times. You can play around with the number of agents, with the size of your city. And you can also then do the counterfactual. What if people are really kind of racist and they really want to have at least, what do we want? 80%, 85% similar. They can tolerate this one Roma person in their neighborhood, but no more than that. Well, let's do it. Go once. People move because they're unhappy. They move again. Well, it doesn't happen, right? We don't get a segregation. People are unhappy, it's an unstable environment. So it's a very simple conceptual model that really created, was a new way of thinking about the world. And that was, so that's this Rand working paper, and that he eventually did. So that's what you can do with Asian-based models. Conceptual thinking, interesting insights. But if somebody asks you, we're going to change our tax rate like this, what will be our budget 5 years from now? Those models are useless. That's where we get into the microsimulation. So microsimulation, they're for quantitative results. They're empirically based. They're more complex, varied transitions, simpler, less surprising dynamics. And sort of the simple thing, and I don't, in Brno I had a couple of slides on this, but we don't need that because here Mr. Euromods is sitting here, so ask somebody about how these text models are used. Any more of you do microsim text models? Well, okay, here over the side are the text models. So it is microsimulation. You take a proposed text schedule, you apply to a sample of text pairs, you calculate the total tax effects, distributional consequences, and sort of the main tool is the Euromod model. That's microsimulation. Well, is it boring? Well, maybe it's boring. Is it tedious? Yeah, maybe it's tedious. But that is the policy type analysis that decision makers need from an analyst, right? So it's fine to do theoretical models. If you're as brilliant as Schelling, you can do it. If you're not as smart, you end up with more pedestrian models like me, and you can still be useful. This would be sort of the simplest way of doing the microsimulation, static text models. And I'm doing something that gets a little bit more complicated. I want to involve dynamics, how people, in particular, I want to do aging models, how people develop over their lifetime. And that gets more complicated over time. All right, now I'm going to do a few detours before I show you my model. So my background, I got a PhD from Stanford in economics, and I did some statistics. Econometrics would be my area. And most of my research, my career, was at Rand, which is a think tank. It's not a university or an academic department. And that may sound strange, so I'll show you pictures of that. So a think tank is really a research institute that comes up with new ideas that could influence public policy. And at Rand, some of our evaluations was not necessarily how many papers we publish, but do our papers that we publish have a meaningful impact? Are they policy relevant?
Sorry, excuse me.
Yep.
Maybe I missed something. I thought that Don said that you have 45 minutes. It seems to me that you're halfway through, and is this going to be about big data health policy?
We're getting there. We're getting there. Don't worry.
Okay.
I'm going to show you something with a panel of 150,000 people.
Okay, thank you.
I think this will be big. Do you have a bigger panel than that?
Well, it's not just the size of the number.
No, I could. And at the end, I have 50 more slides for other things with scanner data, which we can get to it. But here, here I want to bring you about the simulation part, how these pieces belong together. Because today I had a discussion with somebody else. Hang on, that's what. All right, detour. Yes, detour. Here's what Rand is. We have. This is the organization where I'm coming from, and this is where it's located here. This is our building here, Rand. It's in Santa Monica. There's the pier and the water, and it's unusual. It's really no students here. We have a PhD program. And also I want to tell you about my students, because now we're getting back to the big data here. We do have a PhD program, but my students don't necessarily become economists. So Rupeng An is now has an endowed chair in data science at New York University. So he's a data scientist in that respect, not really an economist. And here are the people that some of you will maybe see again. They're visiting Brno soon. Brian Theisinger, who's the director of health policy simulation at USC. Not sure if you have scheduled him for a visit. He'll be here in a couple of weeks. Annie Chan does the microsimulation model for Taiwan aging. See? And then I had a fourth space talking. Is it big data? No, but Silvia Montoya runs UNESCO's Institute for Educational Statistics, so she collects all the big data on education statistics worldwide. So they did their PhD with me over different periods of time. And I gotta do another little detour, sorry. So what do I think about data science? Statistical learning is about reality using data. And data are noisy, they're random, and they're too large for human brains to process. And we need a lot bigger data here for lots of things because there's no magic there. Analytic tools cannot create insights from uninformative data. They can create a nonsense, but it cannot create data. So where are you? We had a discussion this morning. Ah, yes, sitting over here, right? So your approach was you wanted to start with machine learning, with AI, and I'm saying no. What comes first is data. Data has to come first. And you have to dig up the big data sources to estimate the small effects that you're after. So data comes first. And after the data, well, okay, let me say it again. Data come first. So you always have to develop on the data because the data size, the quality, and the substantive questions determine the tools. The tools do not have to be complicated necessarily. The tools can be quite simple. I would say start with descriptive statistics and simple regression models before you build a more complex model. Because once you work with the data, it helps to identify the data limitations. It often clarifies the research questions and what simulation models and approaches are promising. More often than not, I encounter problems with the data. So big data, scanner data we use from the supermarkets. We had billions of records. Well, yes, billions of records, but there were some systematic data issues that need to be resolved. And you're not finding those by tossing things into some machine learning thing. You have to do simple models, check for data quality, and go on. Let me tell you that my approach to data science is a little different in that I want to answer policy or business questions, and a lot of data scientists have a different thing. For them, it's about labor-saving devices, right? They do this to get automatic extractions from medical records. It's a labor-saving device, whereas I want to use the data science for informing policy. Next, data first. Next, science and substantive knowledge come next. AI cannot formulate policy or research questions. AI cannot even learn about established facts. I've also had this with some of you this morning in the discussion, right? If you want to use machine learning and AI, you probably have to teach or put in constraints into that before you can let it go loose, regardless of how big the data sources are. In the physical sciences and chemistry these days, it's known as science-informed AI. So where you put in constraints that are based on scientific knowledge before you let your complicated algorithms run anything. There's never enough data without guidance constraint. So you got to put the science first. And really, in practice, for more real situations, simple analytics or simulation models are sufficient, or that's really all that is supported by data. So, done with the detours. We're getting on. So, data science detours. Statistical learning about the world. That's what I care about. Information is hidden in the data. They're not created by the tools. So data come first. Think about your data first. Not about machine learning, AI, or whatever the latest fashion is. The next part is conceptual thinking. You probably have to impose some constraints onto your algorithms. That is, I think, the next wave in doing good research. Not adopting the existing tools, but tweaking them by putting economic ideas into the algorithms before. But you always start with basic tools. So policy relevant simulation models depend on the data and depend on a lot of data to estimate magnitudes. There is another approach here why I'm doing simulation. Simulation for me is purposeful model use. So we build a model and we experiment and play with it. This helps us to solve problems, to find explanations, build theory, and predict the future. Basically, I like to do predictions here. I also want to use this to train policy or decision makers to improve the awareness of the policy effects. To provide the tools for them to study effects of proposed policy measures. Now, it's not the high-level policymakers, it's the legislative analysts. The European Parliament has its own research center. These are the people that actually would benefit if you can give them a model that lets them play around with their tools. And in order to build a good tool, you have to have data that only they can access, because it's usually proprietary behind the doors. And so we can build an infrastructure for them that they can fill in with their own data. This is where academic research comes in, and this beats any table with regression coefficients and 3 stars behind published in a journal. Right. So fundamentally, sorry folks, I just have a different idea about the value of published paper in high-ranking academic journals. This is not where we get to have any action. So at RAND we have a bunch of microsimulation models, and this is the one that right now I guess at Jakub Lavka at Masaryk is adopting the future elderly model. And what I'm going to talk about is less this model, but I want to talk about how we built new risk equations for diabetes complication using medical records. The little bit on the future elderly and future Americans models. It was initially developed at RAND in the early 2000s and is now maintained at the University of Southern California. And these are all-purpose models related to population aging, based on panel surveys. They adapted to health and retirement surveys in many other countries, and it may be reaching the end of its life cycles. And here's where I'm coming back to the issue about the data. These are survey data, mostly for Europe it would be based on share, and there's not enough information to support the complexity of the transition models. That's why I'm hoping to dig a little bit deeper in your administrative database. I don't know how it works in the Czech Republic and Slovakia. I think we might be getting some traction about the healthcare claims data. This is the collaboration network that exists at the moment. Well, the Czech Republic is on its way here to be a partner and have it's running. Jakub, you can chime in if you have it running your model by now. But it's close. And my last student developed a model for Taiwan for this. And here's the basic idea of that model, and that's also the basic idea of other models that I'm developing for diabetes complication. You estimate transitions for individual aging, individual effects from longitudinal data. Now, if you have a panel survey, that's good. I would prefer actually having complete medical records for people. I would prefer claims for people. I would like to see earning records from tax records for a whole country. That's where you can estimate transition models that become much more reliable and much more relevant than a survey with like 5,000 people. I think 5,000 people is a small survey that is limited. You calculate forward the trajectory of a baseline cohort, and then you can consider the counterfactual of different baseline or transition functions.
Excuse me,
Yeah.
I'm lost a bit. So now we're at the health question. So what's the research question here? Or what's the
research question here? I'm telling you here about the future elderly and future Americans model, because right now there's a future European model. This is starting to run at Masaryk.
Very good.
And this uses the share data initially, and what I'm saying is I would like to build a fresh model that is no longer that dependent on a small-scale survey, but rather digs into the administrative database, especially if we want to look for health trajectories. Yeah. We need a bigger sample size. Secondly, we want to make sure we can do the population change forecasting, which you cannot really, demographic changes, which you cannot really get from survey data.
Okay,
right? This is the direction I think I'm pushing, which should be coming next.
Very good. That's like
That is the vision.
Okay.
And so
you want to start talking about diabetes application.
and I'm going to go move to diabetes very shortly for a particular case. But I think this is one thing that Jakob Plavka in Brno is working on. I think this is going to be a very nice, very useful model for the Czech Republic. I just see what is the next step. And I think there should be some step just because SHARE is not such a big survey and you often ask questions about dementia or so. Those surveys are too small to get a reliable transition functions. Okay, so, didn't I keep saying this? Yes, so we anticipated, right? Data are really the limiting factor. We have large parameter uncertainty, even for commonly relative common transitions, like the onset of diabetes, and from diabetes, the onset of complications, and this part. You get overfitting equations and predictions run off track quickly. And what I want to get you is a different mindset. In order to estimate or build this model, we have to switch a little bit from how we do academic research. Just because you have a table with significant regression coefficients with all the stars, it doesn't mean that your model is going to work at all. Yes, it's that bad. It really, they run off track in no time. Secondly, the individual level predictions classification is poor. Those of you who have been have done your random forest trees and your regression classification, you're used to seeing classification models that seem to work really well. You do not get this here in economics. The individual transition of somebody retiring, your predictions at the individual level are very poor, but if you get the mean right, you will be okay for the population levels, right? These are no longer individual level models. This is not about the outcome of a surgery. This is for economics. So models do not need to get individual predictions right, but correct averages. And the ROC curves, they're not going to be useful here, because ROC is about the classification using different cut points. For us, the calibration is important, which means the number of our predictions need to match the number of true cases that we see in the future. Not that we get the individuals right, but that we get the mean right. This is a calibration, and that's where the standard tools that you may be expected to use or publish. I had this discussion like 2 weeks ago. I told somebody the ROC curve is useless, and he said, but everybody publishes those. Well, no, that's the wrong mindset for these models. Okay, modeling to diabetes complications. So that's what I'm doing now. Diabetes is a common condition with long-term effects. I like to do diabetes first because it's common, and so even with smaller data I can get fairly good estimates. Secondly, there's a lot of punch there in terms of healthcare costs in the healthcare system. So in the US you get about 15% of adults having diabetes, and you get 30% of the adults over 65. So it's really a huge effect on the aging. So if you look into aging parts. There's a rapid increase in the prevalence with obesity. So the obesity leads to diabetes. And diabetes has the additional problem that it's not this quick killer. So think about old smoking. Smoking, lung cancer, people dying quickly. Obesity, diabetes, small effect on mortality, but long-run effect on morbidity. Additional medical complications that are very costly. I like this part because that tells us something. In the US, the costs related to diabetes care are $300 billion, which is Czech GDP. Right? So that's a big deal. Higher mortality and morbidity than cancer. Then higher morbidity, lower mortality than cancer. Let me see, do I have my obesity slides? Oh yeah, that's what I did last week. Actually, not me, but one of the programmers at Muni did it. You all hear about the obesity epidemic in the Czech Republic. Look, the obesity epidemic is usually, people talk about a BMI over 30. So this is Czech Republic, right? Czech Republic adults are 50 plus. It has been increasing rather rapidly, but it seems to have been bottomed out. And our best prediction here would be we get a small decline in the obesity rate. BMI over 30. Now I want to draw your attention to something very different. I want to draw your attention to a BMI over 35. And there are fewer, but this is not bottoming out. This is going up, right? And then I want to show you to something extreme, which used to be called morbid obesity. No, this is not common. It was basically non-existent 20 years ago here. But this trend comes up. So
Population composition changed, isn't it? I mean, like 2009.
this is not the population. All right, thank you for that question. We cleaned that out. We did that baselining for the population demographics of the Czech Republic in 2022. This is the pure increase in obesity, holding population constant to the Czech population in 2022. Yes, good. This is an argument I often hear, but isn't that all because people, population aging and so. This is the pure increase in obesity effect. So you might say, okay, this is a small line, but the health consequences here are really dramatic of this part. Somebody with a BMI over 30, well, yes, they're overweight, but that doesn't necessarily cause them to be disabled, unable to work, early retirement, amputations. BMI over 40 looks very different. So let me express it in a different way, which is my preferred way of expressing it in terms of relative increases, because these relative increases is what will drive healthcare costs. The obesity epidemic went up here, but then basically flattens out. If you look at BMI over 35, there's no flattening out whatsoever. If you go after BMI over 40, you have a very dramatic increase, and then you can predict what the healthcare costs would be. Well, these are the calculations I haven't done yet, so this comes next. So if this trend would be, what would be increase of diabetes, and then from diabetes we go into stroke, we go into dementia, amputation, blindness. So that's the part. So even diabetes research is a big business. There are dozens of companies and models that just focus on diabetes modeling. And there are some impressive analytic models. And there's really conferences just on modeling diabetes. And if you look at a research literature, you'll be overwhelmed by thousands of papers. But there's a difference between the performance of these models and the promise, and we don't have time to go get to the link of the indigo, right? They will claim physicians print out that screen, give it to their patients as a visual reinforcement, putting it in a refrigerator, all that stuff. But even the clinical risk engines are not very good classifiers. I think we can say a lot about the population dynamics, much less about the individual, even with the data they are. It gets a little bit worse, I would say, because most current diabetes model, it's a big industry, there are dozens of models. They're based on clinical trial from the last century. So I'm not kidding, it sounds like a joke here. But I know about 19 models pretty well. 2 of those 19 models no longer exist. They have failed in the marketplace. And of the remaining, 16 use the risk equations that come from one single study. That single study was a trial that started in 1977 in the UK with 5,000 people. So that is, informs, I mean, hundreds of papers there. And practically, this is what health plans use for forecasting.
Just a technical question. So how does this fast development of medical pill pills or tools for dealing with the obesity kicks in?
They use these prediction models and then assume BMI drops, right? But they use all the risk equations that deal with how diabetes then leads to additional complications. And the counterfactual part they do in their risk equations, they change the BMI and then do all the calculations. And I think this is the problem. And this is what I'm trying to do now. Okay, now I'm telling you again what this is. All right, this is the industry model. 16 models, hundreds of papers. One of them, Archimedes, at one point had 50 employees. So there are millions of dollars they get from pharmaceuticals and health plans to run this model.
So what's the goal of this model? So
Of this,
I like the question.
did this model,
So when you looked at the confidence bands, they were super broad. You didn't even need model for that, no?
well, we're talking here about the next step of models. What do health plans do to set their costs for diabetes care? What do pharmaceuticals do to price their drugs? Which is, they put them into these risk models, they change then the BMI, then they look at what would be the additional or lower costs associated with if people were to use those drugs, and then they price their drug accordingly, which is why Wegovy at the moment is about $1,000. Wegovy Ozempic is $1,000 a month. You know that, right? $1,000 a month, that's the US price. But they use the UK PDS risk engine for this. Now I have problems with the UK PDS risk engine because, first of all, these are data that are 30 years old, for the most part. There were like 5,000 people in there. The model was selected with stepwise regression. So they use their data set, do the old style machine learning then. All right. At that point, this was stepwise regression. They only keep coefficients that are statistically significant and dropped everything else. This is the source of information for pharmacoeconomics, health plans, policy decisions. It sounds terrible, right? Sounds almost like a joke. We should be doing better. So and that's what I'm trying to do. Yes, I'm almost running out of time, but here's what I'm doing. I want to develop am developing a new model for diabetes complication using Kaiser Permanente electronic records. We want to create a new risk engine. We want to have newer data, and specifically, we want to use much bigger data, and we want to take advantage of the fact that new data are being generated at a much more rapid rate and collected. Highly confidential, of course, because there's so many legal constraints there. But what we have right now is Kaiser Permanente in Southern California has 4 million members. I'm looking at people that had been diagnosed at all with diabetes, so about 600,000 over those time periods had any diagnosis for diabetes. Many of them are dead, of course. They're not in my panel. And I can create a fresh panel of 157,000 people that were in the health plan. They got diabetes, were diagnosed newly, and we can follow them over time. We can see how they're being treated and have all their measurements. That is a much more solid way of estimating the transition functions. Now we can play around with machine learning, and we want to do cross-validation. We no longer want to pick our results based on significant coefficients, and that's what we do. And the first step, what I'm doing here is I do a comparison analysis of the standard tool versus our new data. I'm using these 150,000 people. Each of them fit their actual characteristics in the UK PDS risk engine, which is a microsimulation model. I run 10,000 lives for each of these individuals. That gives me what would the UK PDS predictions do, and then I compare them to the actual trajectory. First step. Next step is, of course, we rebuild the new equations. And here are the results. The blue line is actual observed outcomes over time. And the red line is what the UK PDS model would predict. You see this dramatic change, right? So, and as a consequence, if a drug company uses this and says, oh, we can get rid of this problem, they will have alleged benefits that are just way higher than would be realistic.
So may I have just like direct question? So does it mean that they underprice the product? Because they think that the person would die earlier?
Well, no, they go the other way, right? Okay, it depends on your plan. One of my former students is a vice president, Eli Lilly, so I know their pricing decisions part. For them, it's really, they want to see what does the new drug create for benefits. And of course, if you completely overestimate the adverse benefits, then if you remove the risk factor, you will also completely overestimate the potential benefits of that, right? They will estimate much larger increases in qualies, right? You can look at MI. Let's look at myocardial infarction. The blue line is actually how many people over that period of the 157,000 over the next 15 years got MI. It's about 5%. Over 15 years, 5% have a new case of MI. UKPDS estimates that 25% would have DMI. So you give the drug that would avoid obesity at the onset of diabetes, the complications. Well, you might be saving 5%, not 25%. And you get it for a few other equations. So the point is really, we need new data, first of all. We need a lot new data because patterns of care have changed, and if we want to simulate changes in patterns of care, we also need the fresher data. Secondly, you need a lot larger data because the relationships between the clinical indicators and the outcomes, they're a lot more subtle. And the p-hacking approach on 5,000 people is not going to work. So the mortality part, we're going the wrong way. Stroke. Blindness is another one. Blindness is a very common complication, not very common, but it's a complication of diabetes, right? So the point is, can we avoid blindness? And the actual effect is, nowadays, blindness is no longer quite the same complication as it used to be, at least if you believe the equations that would come out of the UKPDS. And so we can do a whole more that I don't want to do, and we're out of time. I want you to discuss more. I can give the event rate, but summary. Microsimulation is an alternative when simpler tools no longer work. Complications of diabetes, when we change patterns of care. This would be a model. Still, data come first. There's really no good model without good input. And going back to small-scale surveys, no. Folks, work on your data here. Getting the data can be the hardest part, is the hardest part. And it's a work that's never done because models age and they lose their usefulness. So what's next? Let's build new models. This is one model I'm building. Ask yourself, what data do you have that could support new risk equations, transitions, or whatever other topic you're interested, right? I'm thinking about dynamics in health. No, don't go and do a search on what public use files do you have. Where are the data hidden, and who do you need to talk to get access to that? We need better interfaces and transparency. That gets me into a very different topic because I said we want to train policymakers and we need to have the simulation tools that they can use. And at the moment, they're terrible, actually, really. The future elderly model is not set up in a way that policymakers or legislative staff can play with. So they are in this whole interface between the models themselves and people visualizing, software engineers. There's a lot of gain. Because I think, punchline here would be, make the models useful for decision makers and train them. It's kind of like flight simulators for pilots. Done.
Thank you very much.